What are cancer markers in blood tests? Now, if your family seems to have a lot of cancer that runs in it, or you've been really concerned about potentially ending up with cancer, you may have been wondering if there's other ways to determine if you're at risk or if you're headed down that path besides just waiting on a scan or a biopsy to detect it. If that sounds familiar, then you are in the right place because I'm here to address that question in today's video. So let's dive on in. Hi, I'm Dr. Kelly Shockley, Doctor of Cause Chiropractic, board certified in sports medicine, specialized in clinical nutrition. In this video, we are going to answer the question, can a blood test detect cancer? The earlier you detect a problem, the easier it is to resolve it. Then we're going to discuss the biggest difference between genetic testing and these tumor markers or cancer markers in blood testing. Believe it or not, there is more information you need to know than what genetic testing will give you on its own. And finally, I'll be answering the question, why is my medical doctor not running these tests? This is a good one, folks, so you'll want to stick around. Okay, let's get started. Can blood testing actually detect cancer? First of all, let's get into the classic way that one is evaluated for, are they at risk for cancer? We know that there should be a comprehensive history that is collected. There should be a physical exam that is done. And then the classic route that medical will use are scans and biopsies if they are of concern. However, we have many different cancer markers, or also known as tumor markers, that we can test for that do occur in your blood. In case you didn't know, the reason why these are also referred to as tumor markers is because oftentimes cancer presents in the body as a tumor. So the different markers you can evaluate through the blood are looking for indication of these specific types of tumor growth. Now, there are advantages to actually having these markers evaluated in your blood. The reason is because tumor markers are specific for different types of cancer. It's not generally like, hey, run this one marker and, oh, yeah, it came back positive or is higher than what it should be. So now we have to investigate through the body where the cancer actually is. No, there are markers that are associated with different type of cancers. Tumor markers oftentimes are used in medical once we already know somebody has cancer and we're trying to determine the extent of it. And then also, how are they actually responding to the care that's been put in place? You see, in the United States, we don't use cancer markers as our diagnostic way for evaluating cancer. We use it to give us more information. But outside of the United States, blood markers, these tumor markers that are specific to different types of cancer, are used diagnostically. In fact, these tumor markers, they have a really high sensitivity for cancerous growth. So why are we not using this as our first step in to evaluate somebody to see if they actually have cancer? It's a really good question. We'll get to that towards the end of today's video. Let's talk more about tumor markers and how much opportunity there is for you to investigate your health to determine, is this an issue, before you actually end up with a more prominent issue. So something you should know, we all are fighting cancer of all different types every single day. Now, don't freak out. We were designed to be able to handle this. Okay, our immune system has this system of checks and balances that keeps this in check. Oftentimes, we have cells that when they're replicated or they're being produced, they may be mutated. The immune system recognizes that that is not normal, it's foreign, and it destroys it. As long as this whole system of checks and balances stays in place, we're fine. We don't ever end up with cancer cells multiplying and growing. So ultimately, if that system gets affected, those checks and balances are not able to function the way they should, now we have the opportunity for cancer cells to replicate. One of the very first areas you could see this happening would be in the blood associated with these tumor markers. The reason being is because it's highly sensitive for capturing if there's cancerous growth occurring. Do you realize, let's take breast cancer specifically. For a mammogram, which is the classic scan that is awful. I mean, if you're a woman and you've gone through the process, first of all, no, thermography exists and it's much kinder and actually detects things much sooner as well. But mammography has been the standard. Do you know that they say on average, a cancer like tumor has to be growing for 7 years before you can actually pick up on that in a mammogram? By the time any type of scan can detect that there's a growth, the growth has to be the size already of the end of your pinky. That's billions of cancer cells. Blood tests will detect cancerous growth long before there's billions of cells that have been able to accumulate. Okay. So yes, this detects it much sooner, much earlier. That's why I said, like, the earlier you can detect a problem, the easier it is to resolve it or to address it, right? Now, there's a huge list of different tumor markers, and I'm not going to go through all of them. I just want to talk about 2 that you've probably heard of along the way. The one that's most commonly ran on a regular basis is the PSA, which is a prostate antigen run on males. And we know that the PSA shouldn't go above a certain range. If it does, then it's probably a sign that that guy is dealing with prostate cancer. That's the only one that generally is ran on a regular basis. One you also may have heard of is CA, which is short for cancer, CA 2729. This particular cancer marker is specific for breast cancer. Okay, so like I said, there's many other ones. I run cancer panels on my patients all the time. Okay? I fly below the radar. I am not part of the standard of care. We do investigative medicine in my office because I know that the earlier we can detect a problem, the easier it is to resolve it. So I run cancer panels. I suggest my patients do that once a year so they can do a status check. Symptoms show up long after something's been brewing for a long period of time. And most often women who've ended up with breast cancer had no idea that they actually had a mass in their breast that had probably been growing for at least, based off of what the research has shown, at least 7 years. Okay, so we run this every year. Cancer markers should always be as close to 0 as possible. None of them will ever be at 0 because we're all fighting cancer every single day. But as long as we can see the baseline and they're as close to 0 as possible, I can then detect if there are cancer markers that are starting to increase, and we can start diving in and figuring out what is it that's going on? What's changed about your life? What's going on stress-wise? How are you eating? How are you sleeping? Are you exercising? All the lifestyle factors. And we can then stop it in its tracks, right? That would be pretty cool. So there's cancer cells or tumor markers for nearly all types of different cancer you can get. I know the panels that I run on my patients, we can detect at least 80% of all potential cancers that one could end up with. So really great way to evaluate and detect something as soon as possible before you wait for it to show up on a biopsy or a scan. Quick side note about biopsies. I am not a fan of biopsies. If something is found, my rule of thumb is either, like, if they're wanting to biopsy, if they are able to, just take the whole conglomerate. Take it all out or leave it alone. Do these tumor markers instead, okay? If you do a biopsy, think of it this way. Your body is walling something off that's devastating to it, okay? Doing a biopsy is like finding a hornet's nest that's mostly contained and now poking it. Oftentimes, if you ran a tumor marker associated with whatever this cancer is that's growing, and then you do a biopsy and you run the tumor marker again, you will see, contrary to what they're trying to say, you will see that there's an increase in that tumor marker. Oftentimes, biopsies can actually exacerbate or proliferate cancer. So either take it completely out or leave it alone and evaluate in some other way. And I'm super curious, did you have any idea that there were that many different types of tumor markers? Like, you could at least detect 80% of all possible cancers? Let me know down in the comments below. Let me know if this is new news, old news, or fascinating news. You want to know more of how you can actually have this done. Whatever comment you have, drop it for me down below. And I promise you, I read every comment. I respond to every comment. I appreciate your feedback. It helps me continue to provide value for you. All right, it's time to get into what the biggest difference is between genetic testing and these tumor markers. So there are different cancers that are out there that we have found you can do genetic testing for. The one that takes like the cake and has all the fame behind it is the gene associated with breast cancer. Remember when we first determined that, and there were a lot of people in Hollywood that were going and having this genetic testing done. And if they found this particular marker, it didn't mean that they had cancer. It just meant they had a really high likelihood of ending up with breast cancer. And women were having double mastectomies, which is highly invasive, but doing that to try to keep themselves from ending up with breast cancer. Okay. So not to get into too much technical terminology here, but one of the things with your genes, like when you do genetic testing, it's expensive, but you only have to do it once because your genes don't generally change. Okay. So there are certain conditions that actually are inheritable types of conditions. They're within the genes, right? Still, here's something you need to hear me out on. If you have a gene for, let's say, breast cancer, we'll stick with that one. It means you have a higher likelihood than somebody who does not have a gene for breast cancer. But what we've learned in probably not even the last decade is there's something called epigenetic expression. And ultimately what we're talking about is, it's almost like, think of genes as light switches. If you turn them on, whatever that is coded for, so in this case, breast cancer, gets expressed. So this person ends up with breast cancer. If the gene stays turned off, then even though it's coded for breast cancer, that code doesn't get put in place. So that person doesn't end up with breast cancer. And what we learned is that even when there's a gene present, it does not mean that person ends up with cancer. What determines if the person ends up with cancer, what takes that light switch and turns it on, is how you're living life every single day. It's lifestyle that really affects and influences what somebody's health looks like. So ultimately what that means is if somebody had the BRCA gene that was associated with breast cancer, they did not have to run out and get a double mastectomy to try to keep themselves from having breast cancer. What they needed to do is look at their lifestyle and see, are they in alignment with what we know is needed in order for humans to be optimally healthy? Are you eating the right way? Are you sleeping? Are you managing stress? Do you work out? Do you drink water? Are you avoiding the stuff we know that is detrimental to our health? And here's the other really cool thing about this. You have a gene that's coded for breast cancer. It gets turned on because of crummy things happening in your life. The lifestyle is not suitable for optimal health. So now this is being expressed. You still have the ability to take the light switch and turn it back off and stop that process by cleaning up lifestyle. Okay. Now, I'm not saying I cure cancer, but this is the underlying of what's actually happening. So genetic testing does give you information. And the good thing is you don't have to do it again because your genes don't change. What changes is the circumstances that you're living in. And are you creating an environment in your body that is suitable to turn these different genes on that now code for different types of disorders and cancers or what have you? Or are you living a lifestyle that is going to keep them quiet and turned off? Now, how is this different than these tumor markers? Gene testing says, yes, you have a gene for it. It doesn't tell you, do you have cancer or not? Blood testing tells you, is that particular tumor marker, increasing? If it's increasing, then we can assume that you have a cancer type of a tumor that's growing, right? In this country, as I said, we do not use blood tests as diagnostic. Outside of this country, they use blood tests as diagnostic. I mentioned I run these tumor markers or cancer markers on my patients all the time. I do not diagnose cancer. If somebody has markers that come back and they're way off the charts, I know we have a serious problem. We have a different conversation. I make the appropriate referral, but in the same time frame of when they're waiting to go see the oncologist, we're working on lifestyle stuff. And then what's super cool is if you've established a baseline, you can now retest and confirm, are the therapies, which in my world is everything natural, are they working? Do we see those markers starting to decrease and go back towards zero? Okay. The genetic testing, you can't tell is the gene turned on or off. I don't know that we have that capability yet. So that just gives us information that, yes, you're predisposed. That doesn't tell us that you have it or you don't. Blood testing tells us if there's a problem or not. Okay, genetic testing, sure, you're predisposed. Let's do the blood testing to confirm how well are you managing this circumstance. If we get really high elevated cancer markers, then we know there's an actual problem that is occurring, okay? Hopefully that makes sense. Now, before I answer the question, why is my doctor not ordering these tests on a regular basis, especially if they're preventative and that's what we're trying to accomplish? I just want to remind you to click the subscribe button down below, turn the notifications on, give me a thumbs up, like down below too if you're enjoying this video. I really appreciate that. And guys, I'm producing videos on a regular basis, helping you be able to take back control of your health because you have the ability to do that. So again, just click the subscribe button, turn notifications on, give me a like, and feel free to send this video to whoever you know that might also have the same concern or looks like cancer is something that runs really rampant in their family, to give them some hope that they might have the ability to not have that be their future health story. Okay, let's get into this. Why is my doctor not doing this type of testing? Now, I am not anti-medicine. I am not anti-doctor. I am anti-standard care. And this is specific to how things are working right now, to my best knowledge in the United States. We have something called the standard of care, and ultimately it dictates what doctors are allowed to do. And if you look at how medicine has evolved over decades, we've compartmentalized it in the United States. So now if somebody goes into their primary care doc, who's supposed to be like the gatekeeper and used to be able to do a lot more for their patients, and you're complaining about chest pain, well, they may do a few things, but they're going to refer you to a cardiologist. Or if you come in and your complaint is about digestive types of problems, they're going to refer you to the gastroenterologist. If you have hormone issues, you go see the endocrinologist. If it's autoimmune potential stuff, you're going to go see the immunologist, and so on and so forth. So they compartmentalized. And then what happens is like, okay, you've got chest pain. You go see the cardiologist. The cardiologist runs tests that are specific to the cardiovascular system. Or if it's digestive stuff, you go to the gastroenterologist. They're going to do tests and evaluation processes that are specific to the gut. Nobody ever gets to just look at you as a whole, okay? And here's the thing, and this might make a few people irritated with me, but this is the truth of the matter. I have said that we don't have a healthcare system in America. Unfortunately, we have a sick care system, and it's for profit. If we changed it to nonprofit, maybe we'd see a completely different approach, but it is a for-profit. They do not continue, the high-ups, not the doctors specifically, the high-ups, they do not make money if people are healthy. You know, look at how things have gone with medicine. Their idea of prevention is putting you on a prescription medication to prevent whatever the outcome is. This is where people, the terms pre-diabetic, pre-hypertensive, those are the two most common. Pre-anything means you don't have the diagnosis. Now's the best time to start medication because it looks like you're going that way. And if we do this now, you won't end up with diabetes. But here's the problem. You can't ever take a medication without it negatively affecting your health. There are side effects that come from that. And then the way that they handle that is like, oh, so you went on this medication, fine. Now down the road, you've got this, and this symptom. Well, here's medications to manage that. All they do is symptom manage, right? Here's the ugly around cancer. First 6 months of care for a cancer diagnosis is anywhere from $500,000 to $1.5 million. They're literally bankrupting families left and right? But that's a huge cash cow for those that are in charge and are reaping the, reward of this so-called healthcare system. If you take out cancer, which right now in the US is the #2 killer for men and women, #1 is heart disease. If you get rid of that, that's a huge cash cow. This for-profit system, people aren't going to be profiting anymore, which really should be the way that it is, right? So the reason why the doctor is not allowed to do this is because the standard of care dictates what they're allowed to do. If they're suspecting cancer, then they have to go through the history, the physical exam, and do a scan first. And then as I mentioned earlier, these cancer markers or tumor markers generally are not ran on a patient until after the diagnosis has been made, after they've already started treatment. Because how do you explain to your patient, like, oh, we're going to do cancer marker, but now we're going to do a biopsy and we reran the cancer marker and now your cancer actually looks like it got worse. I just made you worse. Or we're going to get through the scan biopsy, do the tumor marker, put you on chemo or radiation, redo your cancer marker. Your cancer marker got worse because oftentimes undergoing cancer treatment, chemo, radiation, those cancer markers increase. How do you justify to a patient treatment if you see that the blood work shows it's getting worse? You simply just don't do it there, right? Because you can't justify that. This doesn't look good. So they do it on the back end after they've started treatment to see how are you actually responding to treatment. They caught it at its high end. Yes, there's potential that it can decrease from there. I mean, they supposedly are treating and curing cancer. But I don't know about you. I don't know that I want to wait until that time and point to actually get a grip on things. Okay? So it's literally that doctors' hands are tied because they're only allowed to run tests that they can justify because they have to justify it to insurance. So insurance actually dictates your healthcare, not your doctor. And I know this completely different relationship to this. It's not cancer related at all. I have a trail running buddy who was having major knee issues. I sent him to the orthopedist because I guaranteed that he had torn some stuff. He may actually need surgery. And this orthopedist is not knife happy. He's very conservative. He doesn't just do surgery on everybody. But he said, yeah, there are definitely some, wear and tear. There's things that need to be cleaned up. We need to get this taken care of. And the goal was for this person to be able to do a race this September. This is back in May. Well, the insurance denied the surgery. And they want him to go through 8-12 weeks of PT. Now, you can argue both sides of this. If this doctor actually was very knife happy and he wanted to do surgery on every single person, then this is a great way to slow that down because there are other alternatives to surgery and not everybody needs surgery. That should be an end resort. But at the same point, the doctor knows his patient. The doctor knows the circumstance. He's the one who did the evaluation. Why is he not the one that's deciding what needs to be done for this patient? The insurance doesn't evaluate them. Yet insurance is who's dictating the care. So the system that we're stuck in right now is the reason why your doctor's not being able to do these tests, if they're affiliated at all with a hospital in any way, shape, or form. If it's a completely independent doctor, they probably can. But here's something else to keep in mind before you just run out and ask your doc to run these types of markers on you. If you're running insurance or you're going to use insurance, this will now be on your permanent record. And let me tell you, I have had many patients who we run markers on and their markers come back sky high. And through just a couple of weeks, no joke, no exaggeration, in just a couple of weeks, we can get those markers to start going down. And as long as the markers are continuing to decrease, we're on the right page. We live and die by the numbers. That's why if you're not testing, you're guessing. The tests tell us what's actually happening, but then they also let us know that what we're applying treatment-wise is working and we're not in a crisis. Okay? Be very cautious about this because we still live in this world where pre-existing conditions is a thing and can affect not only you, but can follow through family history, which it shouldn't, but lots of really weird things happen in this country that we would think shouldn't. Okay? You don't want this on your record, especially if it ends up being something that can be resolved. So the type of testing I do with my patients, everything's cash. And it's actually really affordable because insurance inflates the rates of everything. And when you don't play their game, you don't have to do things the way that they do. Okay. Now, if you're sitting there on the edge of the seat going, okay, now what am I supposed to do? I really want to know where am I at? Which some people are that's really kind of scary. But at the same point, wouldn't you rather know now and be able to address something if something's actually brewing versus waiting 7 years or more for symptoms to show up, which sometimes could be too late. Have you ever heard of somebody who goes to see the doctor that walks out with an end-stage cancer diagnosis and they had no idea? It's like the guy who is in amazing shape and goes, runs all the time and super healthy, who drops dead from a heart attack all of a sudden. Sometimes waiting for symptoms is too late. So if you're wondering how in the world do I go about this and know this, don't worry, I've got you. I can help you from wherever you are. And the starting place is located right down in the description below this video. If you click on the description, let it expand. Look for my 5-day health challenge. Now, it really doesn't take 5 full days. But in this, I explain the exact way that I do this with my patients, the exact framework that I use, the approach that's there, how to understand, how to plan, how to optimize, how to actually properly test. And you can do that from wherever you're at. So if this is something that's concern and you're super interested to know what is the other way that we go about this versus standard of care, then click that link down below, sign up, get started, and I can't wait to see you on the inside. I thank you so much for being here, and we'll see you on a future video. God bless.